Good day everyone, I'm Eden Sista and today I will be discussing Anti-helminthic Bioassay. My journal is entitled Evaluation of Anti-Schistosomal Effects of Turmeric, Curcuma longa L versus Praziquantel in Schistoma mansoni infected mice. This is a journal of parasitology published on February 10, 2017. The authors were all Iranian and the study was conducted in Benha, Egypt. The objective of this study is to explore the potential role of turmeric solved in olive oil, either alone or in combination with praziquantel, in the treatment of Schistosoma mansoni. For the bioassay method, first, they tested for worm burden. On the 8 and 12-week post-infection, adult S. mansoni worms were recovered by perfusion from the portomesenteric system, and all of the recovered worms from infected mice were counted under the microscope. Then the percentage of reduction was calculated as shown below. C is the mean number of worms recovered from infected and treated mice, and V is the mean number of worms recovered from infected treated mice. For the oogram pattern, after the perfusion, 1 cm length of small intestine were cut longitudinally, rinsed in saline, dried in filter paper, and compressed between glass slides and examined under the microscope. Eggs of S. mansoni were classified into immature, mature, and dead ones. Results were expressed in terms of mean number of eggs per gram of tissue. For the histopathological pattern, livers were fixed for 48 hours in 10% formalin and then embedded in paraffin. 5 sections, 5 microns in thickness, were taken from each liver specimen, and each sections were stained by hematoxylin and eosin for granuloma counting and Mason trichome stain for the demonstration of collagen fibers. The size of each liver granuloma was calculated from the mean diameter of each lesion as shown below. The mean periovular cuff width is equal to mean diameter of lesion minus mean diameter of eggs over 2. Turmeric powder suspended in olive oil was used as a sample, and infected and treated with 1% DMSO was used as a control. The cercaria of S. mansoni from infected Biofalaria alexandrina snails and male Swiss albino mice were used as models. 80 male Swiss albino mice were divided into 4 groups, 20 mice each, representing turmeric-treated group, praziquantel-treated group, turmeric-treated group, and the 1% DMSO. For the doses, they used 400 mg per kilogram of turmeric and 500 mg per kilogram of praziquantel. The choice of doses were based from the previous findings. Measures presented here are discussed a while ago. For the worm burden in infected mice, they calculated the percent reduction. For the oogram pattern is the mean number of eggs per gram of tissue, and for the hepatic granuloma is the mean periovular cuff width. Let's move on to the results. For the worm burden in infected mice, in the turmeric-treated group, we can see here that on the 12th week of post-infection, it has a 49% total worm reduction, while on the 8th week post-infection, it yields 33% of worm reduction. In this, we can assume that turmeric is more effective against adult S. mansoni than in juvenile stages. A high significance histomicidal effect of praziquantel were noticed in all groups, either as monotherapy or in combination with turmeric. Also, the highest effect was on the couple burden counted on the 12th week of post-infection. For the oogram pattern intestinal segments of S. mansoni infected mice, the turmeric-treated group failed to prove any significant effect on the oogram pattern as compared to the control group. Praziquantel-treated mice exert a highly significant increase in the dead eggs and the reduction of viable eggs. However, in the combined therapy, there was a complete disappearance of mature ova. For the hepatic granuloma in S. mansoni infected mice, the turmeric group showed a notable reduction in granuloma number as compared to the control group. Turmeric might modulate the granuloma formation through a regulation of cytokines expression, especially the TNF-alpha. Also, turmeric reduced the cloudy swelling, and this improvement may be due to the anti-inflammatory effect of turmeric. Also, we can see here that praziquantel showed a statistically significant decrease in granuloma number as compared to the control group. Treatment of the S. mansoni infected mice did not show any statistically significant change in the frequency pattern of the cellular and fibrocellular granuloma as compared to the control group. Praziquantel and turmeric or the combination therapy has a lower effect on granuloma number and size compared to the monotherapy. As we can see here, in the praziquantel treated group on the 8-week post-infection, it has a 42.6% of hepatic granuloma reduction, while on the 8-week post-infection of the combined therapy, it has only 19.3% hepatic granuloma reduction. This is due to the different effects of both drugs on the interleukins, as praziquantel increases the TNF-alpha and interleukin-6, while turmeric suppresses the TNF-alpha and interleukin-6. For the conclusion, turmeric significantly reduced parasite worm burden, granuloma size, number, and pathology of affected liver. The association of turmeric and praziquantel does not significantly enhance their anti-schistosomal activity. Here are my critiques. The use of commercial turmeric powder might affect the results of the study. The study only explored one concentration of turmeric, and a small number of cercaria was injected per mice. Eggs on the liver and feces must be considered in determining the ova count. And since histopathological examination was done, evaluation of some liver function tests must be performed, and there was no baseline data presented in the journal. Here are my proposed innovations. For the sample, I proposed the use of turmeric methanolic extract at lower dose of praziquantel. Impurities might be present in the commercial turmeric powder, and quality is not guaranteed since it was only bought in the market. So fresh curcuma rhizomes will be used to prepare the turmeric methanolic extract to ensure its quality. Concentration ranging from 100 mg per kilogram, 200 mg per kilogram, and 400 mg per kilogram will be used as described from Nasa et al. And Jatsa et al. Also, to lower the dose of praziquantel, since studies have shown that 100 mg per kilogram dose of praziquantel exhibit a maximum efficacy and has a significant effect on worm reduction, recovery, egg load, and histopathology in liver tissue and does not develop resistance. For the animals and infection, I propose that mice will be infected with 180 S. mansoni cercariae. Infecting 180 S. mansoni cercariae to Swiss albino mice rather than 50 S. mansoni will be enough to yield a maximum egg and adult worm for 6 to 7 weeks based on the current protocols in immunology. There should be a strict monitoring on the test animals. For the methods and tests, presented here is the procedure from Aboldahab and Elosinai on the oogram pattern wherein they take into account the number of eggs present in the feces, liver, and intestine. Also, the evaluation of liver function biomarkers. As the most severely affected organ during S. mansoni infection is the liver, alanine aminotransferase, aspartate aminotransferase, and alkaline phosphatase levels in plasma, markers of hepatocellular damage, can be tested using a colorimetric assay from a commercial kit, considering that we have a sufficient budget for this assay. Total protein and albumin will also be determined to indicate the tissue damage and exudation. Also, I propose an additional equipment wherein the use of foot pedal on perfusion of adult worm, since using a foot pedal to operate the peristaltic pump will facilitate the perfusion process by leaving both hands free to perform the perfusion. So here's my proposed experimental design. You can see here different concentrations of turmeric methanolic extract. This is to determine which concentration will exhibit the highest activity and to determine if it follows a dose-dependent pattern. Also, on the combined therapy, this is to determine the synergistic effect of praziquantel and turmeric. So Swiss albino mice will be infected with 180 S. mansoni cercariae. All treatments will be started on the 6th week post-infection, and all animals will be executed on the 10th week post-infection by cervical dislocation. Thank you for listening.